Sure. I'm Randy Zuckerman. I'm a general surgeon at Hospital of St. Raphael in New Haven, Connecticut. I'm also affiliated with the Midhofer Center for Rural Surgery at Bassett Healthcare in Cooperstown, New York. And what I'll do is speak about some recent work we've been doing on surgeon supply across the United States as it pertains to both rural and urban areas.
Randy Zuckerman has been a student in the past of this rural issue, but he's directed his focus more recently to the urban environment. And so, Randy, would you
Sure.
make your comments?
I've spent a lot of time over the last 6 years looking at the delivery of surgical services in rural areas across the country. And clearly, there's a big problem, both in terms of delivery and workforce issues in rural areas. What I'd like to do is talk about some data that we've not yet published, where we looked at surgeon workforce across the country. And to do this, what we did was use the Dartmouth Atlas methodology. So we used hospital service areas. And the country is parsed up into about 3,000 of these hospital service areas. And the way to think about this is these are little healthcare markets. So these are where patients in a geographic area would go to receive the plurality of their care. And there is some overlap of these in urban areas and rural areas. That doesn't really happen. What we then did, these HSAs, or hospital service areas, were set up to look at medical conditions initially. So we had to sort out whether or not this would work for surgery. And it does, and I won't go into that methodology. But what we did was we then stratified all of the hospital service areas by geography using RUCA classification, which is, I think, the most commonly used methodology for looking at how rural somewhere is. Once we did this, we looked at surgeon supply in each of these hospital service areas. And our surgeon supply numbers really matched up to some previously reported data. And what we found was that there's a lot of heterogeneity in these numbers. So for example, in urban areas, urban HSAs, there were about 8.8 surgeons per 100,000 population. In our most isolated rural areas, there were 5.8 surgeons. So there's some big variation there. The question is, how does this really affect access to care? And to do that, what we did was we looked at travel time to the nearest surgeon. And travel time, I think, is just a proxy for access. And this is really just sort of MapQuest, if you will. And what we found was that really, even in the most isolated rural areas, about 70% of the population lives within an hour of the nearest general surgeon. That's not the nearest tertiary care center, that's the nearest next general surgeon. So the question is an hour a real problem in terms of access? I don't know. If you have a time-sensitive surgical problem, a ruptured abdominal aortic aneurysm, if you've been in a car wreck, that hour is a big deal. If you have a hernia, it's probably less of a big deal. The other thing we looked at was how things have changed over the last 10 years in terms of surgeon supply. And really, sort of going against the grain of what people have been talking about recently, we found that there wasn't a big change from 1996 to 2006 in terms of absolute numbers of surgeons across the spectrum of geography. So even in isolated rural areas, the numbers stayed the same. But a few interesting things happened. We didn't just look at general surgeons. We looked at people who call themselves abdominal surgeons, trauma surgeons, colorectal surgeons. And really what's happened is people are more specialized in terms of how they self-report what they do. But in terms of absolute numbers, we're okay. How does this play out sort of across the country in terms of geography? There are about 70% of these rural HSAs that across the country would fall either into the low supply category or have no surgeon at all. So it's clearly a much bigger problem in rural areas. But in 20% of urban hospital service areas, they had a low supply of surgeons. And by low supply, that's less than half the national average of surgeons per that geographic region. If that makes sense. So for example, and this varies widely across this country depending on the geography of the states. So let's use two states as an example, Florida and North Dakota. They both have about 15% of their population that would live in an area of low surgeon supply. In Florida, all of those hospital service areas are urban being population centers of greater than 50,000. In North Dakota, they're all rural. So what really struck us is, I've spent a lot of time thinking about how you deliver surgical care in rural areas. This is not just a rural problem. And my guess is that this will become a bigger problem in more densely populated areas as time progresses.